Hi, everybody. So welcome back to another episode of Heart to Heart. This is a IGTV and now newly branded YouTube series started by myself, Dr. Ambreen Mohamed, and my partner in crime, Dr. Aamisha Gupta, where we talk to not only today's cardiologist, but as you can see, Dr. Oshea is not a cardiologist. He is an infectious disease specialist. So now we're starting to branch out and talk to many different specialists about their journeys through medicine, their social media presence, which I'm sure you're going to be really excited to talk about, and really just learning about them as people. So today we are so incredibly fortunate to have Jesse Oshea. Am I saying that right? Oshea?
O'Shea.
O'Shea,
Yeah.
sorry, I apologize. So he completed medical school from Florida State in Florida. He did his internal medicine residency at Yale, and he is currently completing his, I don't know what year, of fellowship of infectious disease at Ambreen in Georgia. He has graduate degrees in health policy, economics, global health, as well as as a Rotary Global Grant Scholar at the London School of Economics and the London School of Hygiene and Tropical Medicine. Wow, that is a mouthful. He has published in multiple medical journals, participated in multiple clinical trials, and he's also appeared on a lot of different media channels. His recent passion has become fighting against misinformation with COVID, and he's also helped create the COVID outbreak tracker for the White House. You are quite an accomplished young gentleman, sir. So we are so excited to have you. And so just to get started, we like to ask all of our guests kind of how they were able to go through this journey of medicine, what led you here, and ultimately to infectious disease.
Yeah, the first kind of question I think about is why medicine and then why infectious disease? And for me, I believed it enabled me to help the most amount of people I could. It gave me the skill set necessary to really impact what I felt like was the most amount of people. And I can't believe I'm thinking about these things still 16, 17 years later, but I live by kind of two ideals. And the first is the more wise, the more rich, the more powerful one is, the more is their burden to lessen the sum of human misery. And two, tomorrow can always be brighter than today. And, when I had these philosophies as a teenager, it really made sense for medicine. Was a great way to really live by those ideals. And then, when I was a teenager, both of my parents passed away, and I really realized the importance of prevention in disease. So that kind of entered my mind of this prevention, this public health thing. And then for infectious disease, I could literally list 1,000 reasons why I went to infectious disease. I've written about it in a few journals, but I think infectious disease, and I know most of the people here are cardiologists, but it mixes individual and population health perfectly in this prevention picture, and really is entangled in the social determinants of health. It's so deeply rooted in public health that I can impact both the patient that's in front of me in the exam room and those well beyond my exam room. And then intellectually, as you guys know, every case is fascinating for infectious disease. They always present complex problems. I feel like we are little detectives, and I think that's a well-known thing, that if a case is truly fascinating and we're kind of scratching our heads, oftentimes people say, why haven't they called infectious disease yet? So we come in and kind of solve cases, and it's really fun, and it's can be intellectually challenging. That to me is really fun. And then lastly, and the most obvious, I think, is COVID-19 made this crystal clear. But infectious diseases are the one thing that has the potential to wipe out humanity and pose a real threat to humanity. And I wanted to be in that workforce to be geared up and ready to fight and combat the next pandemic, the next thing that really threats our humanity. So I don't want to go on too much, but those are some of the reasons why I chose infectious disease.
That's awesome. Ambreen and I love to hear everyone's journeys and everyone's stories. And like you said, it's so important, especially right now. But, both of us being in the medical field, and like you said, we have infectious diseases everywhere, right? And so whenever we consult the infectious disease team, it's detective work, and it's, finding out things at the micro level. So it's really finding out what's behind what's happening. And we, as cardiologists, definitely appreciate the work that all of our infectious disease specialists do. So thank you for sharing, why you specifically went into it. And you also touched a little bit about, making an impact. And as we've seen in the past year and the past few years, there's been plenty of misinformation on social media and on media in general. So why do you feel it's important for physicians like yourself, or at any level of training, to really speak out against misinformation? And what steps can we do make more of an impact in that way?
Yeah, the social media and misinformation has really been a fascinating dilemma that's come up in the past few years, and really the power it has in shaping people's decisions and minds, not just in medicine, but elections and philosophy and ideals, and it's quite scary. It's been already shown that misinformation travels much faster than actual truth, evidence-based, information. It's scary to think about, and it's actually quite hard to discern truth from falsities. And I joined social media to really fight this. I see misinformation even today, just simple articles of one line from reputable news sources that isn't really factually correct. And it's our burden and our obligation, really, because we are the people that can point that out. A lay person most lay people don't have the ability to know this nuanced information that are coming out in these news articles about health, about new medications. And it's our job, really, it is part of our job to protect the well-being of our patients and to equip them with the necessary knowledge to know that this might not be true and it might be bad for you. So really my main goal with social media is to try and combat misinformation, and because it can be super harmful.
So I'm sure you've seen, I'm gonna throw back a question at you. That's not part of one of our questions, but I'm sure you've seen on social media, especially Instagram. It's an incredible platform for many reasons, but obviously it's not for a lot of other reasons. And we'll get into that. But there's also other types of, maybe they're, the functional medicine people, alternative medicine. Maybe there's even physicians like us, whether MDs or DOs, that don't necessarily support evidence-based medicine. So how do you combat those people that are spreading misinformation because they actually think that they're spreading the right kind of information and they have a lot of followers that they're engaging with?
Yeah, I'm new to this kind of war that's I've seen on social media, predominantly Instagram and Facebook. I think it's really prevalent in cardiology. It's really curious how that's come about. I think maybe because of the role diets play in living a healthy and lifestyle intertwines with cardiology so well. I think maybe that's the reason why. But I've really seen this army of cardiologists against this army of these functional medicine people producing cures and this sort of thing. And I will say, people want answers. And they're willing to attach themselves to answers, even if it's not really correct. They just want to know why. For example, I just saw a post yesterday about, PCOS, and it was a person pushing a diet change for PCOS, and he said the cause of the PCOS, meaning the polycystic ovarian syndrome, was caused by a virus, Epstein-Barr virus, which is not the case whatsoever. And he had several hundreds of thousands of likes to that. And I was just like, I don't even know where they're coming from, this information. So I think people wanting answers and wanting a quick fix, and this new trend of trying to live a healthy lifestyle, which is great, really has been this trifecta perfect storm for these people to come about and to have huge followings. I will say to everyone, really, and I don't know if this was really to your question, I'm kind of just getting on a soapbox, but is if you see someone that has a large following and they're pushing a product, to me, that automatically raises a red flag to me that maybe they have some inherent bias in whatever they're saying. They've got a lot of skin in the game. If they're pushing a product, whether it be their product or someone else's product or a sponsorship, to me, that just raises a red flag. And then second, I look at the credentials, right? Is this person credentialed to talk about these things, right? What is their educational background? Especially, it's very easy to point that out in infectious disease. It might be more challenging in functional medicine with cardiology. But for me, if I see someone that has a master's degree in education, talking about the complex nuances of structural virology that even PhD, MDs have a tough grasp on, that automatically to me is like, wait a minute, this might be challenging. And then if someone says they have a quick fix or a cure to something, to me, that also raises a red flag because there aren't many cures in medicine. I mean, there's some, but there aren't too many. And so to me, those three things really, when I look at someone's profile, I go through those stages and I say, okay, they're a trustworthy, it might be a trustworthy person. And then lastly, there are outliers to these, right? Occasionally you'll get someone who's really, truly brilliant that doesn't have the same credentials as someone else that really just takes off and does well. That is trustworthy. But anyway, I don't know if that answered your question. Sorry, I'm totally just blabbing.
No, I think it did, because at the same time where we're encouraging people to fact check and to check their sources, I think we have to define that, right? Like you said, by fact checking or checking our sources, what does that mean to the general public? So that means finding somebody with the right credentials, but it also means that once you do find that person, that they're explaining things at a level that they can understand, right? Like if somebody is explaining, I don't know, rocket science to me, I'm not going to understand it as I do medicine, right? And so I think that's the thing, is that, like you said, it's our responsibility as physicians and as scientists to get the correct information out. And when we're telling people to check their sources, that the sources that they do find, then, whether that's a physician or a scientist, then explains it to them in a way that is, understandable. And it's, a lot of people have said this, recently with the vaccine as well, is that I've had it even in my own practice where people who are technicians or nurses are coming up to me and, I don't really understand what they're posting in the media. Like, can you break it down for me? And it's about that conversation. And I think that if that conversation is coming from trusted individuals that have the understanding of the information and that can relay that information, that's where, the message is going to break through. So I think you answered the question. And I think it, like you said, it's a responsibility that's on all of our shoulders. Definitely.
Yeah, it made me think also, and that fact checking is for people to fact check the information, not just the source that it's coming from, the person, but the information, right? Mm-hmm. So there's a hierarchy of evidence-based medicine, right? So if someone's quoting a blog post from some unknown and citing that as factual evidence-based information, to me, that's a red flag versus a randomized clinical control trial at an esteemed university in a huge journal. So I think understanding not only the source of the person that's posting it, but also what they're posting and what's the evidence behind it. And I think it's healthy to ask questions. Even me, when you look at my Instagram, ask me the questions, the hard questions, say, what's the source for this? Is there data to back this? That's what I expect and want to hear. So I think even as us as physicians in between each other to have this curiosity.
Absolutely. So, clearly, as we've seen and stated before, you have this love-hate relationship with social media. But obviously you've become such a hit on it. And I think it's because, you do try to, combat misinformation and put out, facts and really try to answer questions honestly and question sources when you feel like there might be, something to question. So, not only are you great on social media, but obviously you've also been interviewed on these multiple other, media platforms. So I think the question is more really about how are you able to get started, not really even with social media, but just, actually getting interviewed, maybe on whatever various platforms you've been interviewed on. And what kind of advice would you give to trainees, students, trainees, and early career physicians who have similar aspirations about utilizing the media and social media to elevate their own careers?
Yeah, that's a great question. If you would have asked me, a year ago, I wouldn't have been able to answer that question to the degree I could, right? So I'm only 3-4 months old in social media, but I think for one, people wanting to have a name for themselves, I suppose, a brand, you need to have good content that's relatable and clear to your target audience, and you need to be truthful. And if you have those things, I think an organic following will happen. And to keep creating that type of content, don't just post a couple things and then give up. I think really just continuing to do it, and in utilizing different social media platforms to do that and to really kind of promote your messaging, I suppose. In recognizing the differences of each platform you're using, right, and the audience. So if you're using Instagram, it's a way different audience, at least for me, than Twitter, right? So Twitter is a big echo chamber for infectious disease doctors and epidemiologists, where we kind of just say something and then it just echoes throughout. So to me, it's a way different academic audience than Instagram is, and LinkedIn and those other things. So knowing your audience, and I think being authentic is super important. And I think really that's probably, I think the key to why I now have a following is because I'm authentic and I'm not pretending to be someone I'm not. And revealing that personality and revealing vulnerabilities, I think is pretty clear if you go to my Instagram page. And people are attracted to people they can relate to, and humans, right? So if you're coming off as just this information bot with no personality, that's not who you are, and you're I think it'll be tough. But if you come off as someone who's truly authentic, that's a real person that goes through human experiences and suffering and loss and love, then people will relate to you. And then to answer your question about media, right? So not social media, but news outlets and media. I think this is a more challenging thing. You have to one, have that name for yourself already, and to be contributing something to that the news outlet wants. So whether that be a a research article, right? So if you're a young medical student and you're doing great research with a mentor, there's a chance that if your research is published, that media might take it up and want to interview you about it. Or if you're a part of a great organization that's doing great work, they may want to interview you for that, or a nonprofit, or an event that you're doing. And once you're on one news outlet, it kind of validates you to other news outlets that maybe you're a person that's a good source. So I think that's a way in, is getting involved in a project or a research project or nonprofit or something that can get you into that. The other way would be writing. That's really what I do. In my second, other life, I was a writer, and I continued, to write, and that's easy for news to pick up on, is, op-eds and things like that. That would be the easiest way to enter into the news world, is to write an op-ed that's published in a newspaper or a news outlet. My entry, and since we're talking about journeys, to the news, really this last year, not prior to this last year, because that would be for other things, but this last year was really fact-checking the administration and tracking COVID-19 in the White House itself. It became very clear early on that no one was really tracking the potential outbreaks of COVID-19 in the White House. And that was alarming to me because they were putting lives at risk because they were still having events and exposing others. And the administration, right? People were in the hospital with severe COVID from events at the White House. And to me, that was, it was wild. And so I created this tracker, and news obviously wanted to pick up on that because I was tracking people who had been infected, who were exposing others, and what their status was. And it was a newsworthy thing. And I'm glad they did, because I think in the end, we probably saved some people's lives by preventing exposures.
Absolutely. How are you able, by the way, how are you able to get this information from the White House about everybody that was infected? Is that, you have like a smirk on your face?
No. I don't want to make this about, COVID-19 and the outbreak tracker, because, now that's a distant memory, right, with the new administration. But
yeah,
it's all publicly or through sources that were there. So it's all publicly available information or through sources that were there. For instance, if a senator announced through a press release that they've been exposed to COVID-19 or became positive, we would kind of go back and check that and see, look at pictures of who was around them, and outsource it as well. We have people submitting tips, and anyway, I could go in the weeds about this. I also was not alone in that journey, and if we're going to talk about that, I need to shout out my team, which are two other people.
Yeah, no. That was just a little. Yeah. I'm not going to get on a soapbox, but
no. But what you kind of are talking about is that if you're passionate about something, right, no matter what the project is, then and you follow that passion, whether that be at a local level, at a community level, at a national level with media. You'll find the opportunities there, but you have to be authentic to it, right? Like, you have to follow through with your passion and be authentic to yourself, because otherwise people can read through that. So I think that message is super important for our audience, which is mostly students, trainees, and physicians, and those others in the healthcare realm. So I do think that's an important message to continue to convey. And being that you're passionate about public health, and everything that's been going on in the past couple of years, on top of being an infectious disease specialist, how do you think, as a field, as a whole medical field, we can do better with increasing diversity, and how important that is in really public health and medical care?
Yeah, I think infectious disease is more fortunate than other specialties for diversity. And I think we're really proud of being a very diverse physician workforce. And I think partly it's because of the global perspective we have, right? So, a lot of global and public health, and venturing into other countries and in diverse communities, I think lends itself really to this diversity. So infectious disease as a workforce, I think, is one of the most diverse. And I love that about the field. It is one of the most, makes me so proud to be a part of this workforce. But and it's so wonderful. I think what we could do better in infectious disease and in medicine in general for diversity is having role models out on the forefront that are, publicized, that people can relate to, with diverse backgrounds, and display and encourage this to others. We really need more of that. I mean, even with the vaccine, for example, Moderna's vaccine, one of the people who helped with that vaccine was a young woman of color from North Carolina, whom is simply remarkable. And if people knew and had that as a role model, maybe that would have reached different audiences that you wouldn't normally think about, and get to different corners of the world that, it's not what we see. I feel like we're so used to seeing these role models like Fauci, who are, to put it bluntly, just old white dudes. And And I think that's really a problem, is we need to have different role models and putting them on the forefront so people can see and understand these are the heroes that we have and that already are out there and that we need. So I think that's one way to kind of optimize diversity in the workforce.
Yeah.
Absolutely. I think visual representation matters, right? We've talked about that before with others as well. But seeing somebody, I mean, even with our vice president, right? And for girls all over the world, like seeing somebody in a position that you never thought you could achieve makes a huge difference, whether, one admits it or not, it's true. And like you said, highlighting those people in leadership positions, in their achievements and their accomplishments, I think would make a huge difference, in the generation that's coming behind us.
Yeah, no, 100%. I'm, I remember at Yale, I just remember in one of the hallways, there's portraits and it was all old white guys and there was not one woman or someone of a different, background. And it was a very just enlightening moment for me that I'm just, I realize how privileged I am, but at the same time, I'm so sick of just seeing old white guys in these roles of power. And I'm so thankful that, we now have a new administration that represents a small sample of diversity that is America.
Jesse, guess what? We're sick of seeing the old white guys too.
Yeah, no, I know. I'm like on a soapbox right now, but I really have no place to talk, and I recognize that.
Yeah.
Oh, well, honestly, you said some amazing things today. And, I think Ambreen and I could talk to you for like another hour about all of these issues and all of these topics, because honestly, these are things that we're all passionate about. So I think that, we'll leave our audience today with these golden nuggets that you've given us. But is there anything else that you'd like to tell them about either your journey or, what you hope for the field or for public health in general in the coming days?
Yeah, in terms of the young medical students or students in general, residents and younger fellows, I want to encourage you to be eager, say yes to opportunities. Really think hard before you say no, even if you feel like it's a really hard challenge, unless you're overstretched and feel like you can. But I really encourage you to say yes to things and not be afraid of saying yes, even if you feel like it would be a big challenge for you. Be willing to take these challenges and be willing to get involved, whether that be in a research project, at your institution, in your school, in your community, and don't be afraid to reach out. I found that everyone is really welcome to helping others. No one gets anywhere by themselves. And that is a truth that I realized in my own life with my own mentors. And I encourage you to reach out, whether it's even to us three up here or anyone at your university or institution for asking to be a mentor or a research partner, or if they have any opportunities to help advance you as a learner. And the opportunities will come if you're honest and hardworking. And I think those are important little nuggets of advice for those starting off their career. And also, be resilient. Sorry, I just have be resilient. In my own journey, I had times where I thought, there's so much going on in my personal life that I could have given up. I remember in medical school, my brother ended his own life, and there was a time that I was just like, you know what, I can't push on. This is too tough. And just to be resilient. Life happens, and power through and be strong, and you'll get through everything. And then in terms of the pandemic and public health, it's not going anywhere anytime soon. Continue to social distance, wear a mask, and vaccinate when you can. These are essential things to ending this thing and ending our own suffering in the world. So,
absolutely agree to all the above. Well, thank you again, Jesse. Thank you so much for spending this evening with us. And to everybody who watched tonight's episode, thank you. And we'll see you next time.
Thank you so much for having me. Bye.
Bye.